Good morning, everyone. Chris from the Headache and Pain Management Centre here, and today we are talking for people who have the really tight, compressive, really firm band that goes around their head, either at the back or it feels like a baseball bat sort of being smacked right across the back of the head, or perhaps in the temples. And those people are suffering tension-type headaches. And today, as part of National Headache and Migraine Week, we are talking about tension headaches on Tension Headache Tuesday. To give you a bit more information about what's happening there. If you're joining us, make sure you type in below and type in your name, say hello so I can see that you're there, and interact with you while I'm talking to you. I can see that someone's there already, ready to go. So yes, tension type headaches, they're the world's most common actually headache condition, tension type headaches. So it's characterized by a really tight band sort of feeling, like compressive vice-like sort of feeling across the front of your head, sometimes the back of the head. It feels like you've been whacked at the back of the head or the neck, or it also squeezes kind of around your temples, and it's really quite nasty. Now, what's important to note about these suckers is that people get them quite often. A lot of people, even people that don't, suffer headaches and migraines normally, do get the odd headache. You can take a Panadol or a Nurofen and those things kind of go away. But this video is more for people who get them daily, or twice, 3 times, 4 times a week, or they're really struggling to get on top of it, really struggling to actually control what's going on with these tension type headaches. So when it comes to tension type headaches, how it's defined is that, vice-like compressive type feeling in your head, which apparently has no cause. So when you have no cause there, basically when you have that, it's almost like a mystery when we're talking about what's going on, but it needn't be a mystery. We know more about tension headache now than what we used to know, and more about what the causes of tension headache actually are. So if you'd like, I'll run through that for you today so that you get a bit more information, so that you know where you can start with tension type headaches. Got someone actually messaging me right now. That's what happens with live videos. It always happens. No one texts for the whole morning, and then they start going. So when it comes to tension type headaches, okay, what we now know about the way that tension headaches work is that when you have tension type headache, it's actually part of a whole system that happens within your brain. So all of the nerves that pass from pretty much here all the way up and over to the back of your neck, all pass in through the same area in your brain. Okay, so g'day Grace, good to see you there. When that passes through all those nerves pass through your brain into this special little area at the bottom near your brainstem, and I like to call it the headache hub. The long word for it, for those playing at home, is the trigeminocervical nucleus, but you don't have to remember that. So basically all the nerves that go in from your head, neck, face and jaw and scalp and ears and eyes all go into the same place, into the back of your brain. And what happens is that that part of the brain is meant to filter all the information and tell you if something's good or if something's bad, if something's right, something's wrong. This is really useful if you've had something really, really nasty, like a stroke or a concussion, or there's an infection or extremely high blood pressure. Because obviously we need to know if there's something really going wrong there, so that basically your headache warns you of something really, really nasty happening. But obviously when we've got tension type headaches that are there for a really long time, they've sometimes been there for some patients that we see sometimes 25 years or more. Clearly if there was something really wrong, it probably would have killed them by now, or it would have been something that had been picked up diagnostically by their doctors or neuros. So the question is, what's actually going on here with these people that have really nasty tension type headache? And what the answer is with these people is that these tension type headaches are coming as a result of what we call a sensitization of that nerve center at the back of the brain. So that trigeminocervical nucleus, that headache hub, it becomes really sensitized. Now what that means when you have sensitization is that basically normal input that gets passed through your brainstem starts to become interpreted as abnormal. So normal feeling that should be, just taken, I suppose, at face value by your brain, a change in blood pressure, a change in stress level or hormones, or even a little bit of a change in the tightness or stiffness in your neck, can be interpreted as really, really nasty by your brain, and which causes all of these really, tension type sort of vice-like pains to happen in your head. So what we like to sort of think of headache and migraine about as far as we're concerned, is it's a referred pain. Okay, so a lot of headache and migraine is actually referred pain that's coming from the back of your neck. Okay, as a result of that nucleus, that part of the brain that's really sensitized. So obviously when you have a really stiff neck, sometimes what happens is you get sort of tight and stiff sort of down the back of your neck here. It might feel like there's a bit of a tight spot at the top of your neck here that you're trying to get stuck into. And that's quite normal. Some people just get stiff neck and that's all that happens. And some people can have a really stiff neck and don't actually know that they've got a stiff neck at all. Like they just feel like they can't really turn all that much. Like it's a bit stiff to turn, or it's just a little bit uncomfortable. But for a lot of people that have tension type headache, what happens is that they've got this stiff neck and their brain is misinterpreting that stiff neck information as a headache. So what happens is you get this really nasty compressive feeling across the back of your head, this vice-like feeling across your temples, or it feels like, and this is a really common one that people say to us, it feels like a baseball bat is being whacked across the back of your head. G'day there, I can just see someone else's joint, it's good to see you. So when you've got this sensitization happening at the back of your head in that brainstem, which is being caused by a really stiff neck, basically, when you're taking medication like your Panadol or a Nurofen, or sometimes even stronger things like Panadeine Forte or things of that nature, basically what it's doing is it's taking the edge off the pain. It's putting almost like a chemical band-aid on it. So it takes the pain away temporarily, maybe for a couple of hours, or maybe it just takes the edge off. G'day, Rona, good to see you there. When we've got the tension headache, which is like a 6 or 7 out of 10, you take a Panadol, it goes down to like a 3 or 4. So it takes the edge off, you can get functioning again, but it's not really dealing with what's happening. That tension headache's got to come back. And once the medication wears off. So what we're looking to try to do is to take the tension headache and kill it at its source. And where the source is a lot of the time, and I'm talking somewhere around 70-80% of the time, is actually the joints at the back of the neck. And quite commonly, it's the joint right at the very top, so right up in here, just at the base of your skull, which is the main problem. So when it's stiff through that joint, what happens is that you've got a stiff joint. Your brain misinterprets the information of that stiff joint, and instead of saying, hey, I've got a bit of a stiff neck, it goes through that sensitized headache hub, that sensitized nucleus at the back of your brain, and is misinterpreted by your brain as actually having a really nasty headache, one that sort of knocks you at the front of the head, or like a baseball bat at the back of the head, or that compressive feeling at the temples. Great, Amber. I'm glad you understand it. Given that, I sometimes think I talk a bit too much, but I hope you get that. So you've got that stiff neck, goes in through that really sensitized nerve center at the back of the head, and gets misinterpreted by your brain as something that's different. Okay, and in this case, it often gives you a tension type headache where it sort of whacks you at the front of the head, and that's why those medications don't often work, because it takes the edge off, it takes the last step of the process and tries to decrease the pain a little bit, but it doesn't actually take care of the source, which is actually a stiff neck at the top of the neck. And usually for those playing at home, it's normally the very top neck joint, so the one just under your skull, or the one between number 2 and number 3 in your neck if you've had treatment on that before. So if you've got if you've got tension type headache, basically what you need to do is you need to get your neck assessed. So if you go and get your neck assessed by someone who knows what they're doing, and I will say that not all physios, chiros, osteos are the same. You need someone who knows what they're looking for when it comes to headache, and it's normally in the front to back direction as well. So a lot of the time, one of the mistakes that people make when they're getting their tension headaches treated is they're getting treated down the sides of the neck, and they're getting treated with rotation, when what we're looking to do is to get treatment in the front to back direction, because that appears to be the most common thing that is the cause of tension type headache. So cool. 3 takeouts from that. Firstly, tension type headache is caused by a sensitization at the back of your neck, the back of your brain, bottom of your brain, top of your spinal cord at the brainstem level, which that sensitization gives a misinterpreted signal and gives you a headache. Secondly, the most common thing that causes those tension type headaches is a stiff joint at the top of the neck. And thirdly, when you're trying to treat these tension type headaches, you need to make sure that it's not just a medication-based type thing, because if it's medication and you haven't had your neck checked, it's not going to work. And secondly, if you're getting your neck checked when it comes to all of this, make sure that they're actually treating not just in rotation, but also front to back as well, because that's the main thing that causes tension type headache, is a stiffness at the neck in the front to back direction, sort of nodding or sort of going back like that. So they're the main sort of takeouts from that. Hey, I hope that's been helpful today. So that was Tension Headache Tuesday for National Headache and Migraine Week. G'day Sarah, good to see you there. And basically tomorrow I'll be actually back in the office tomorrow reporting on this one. I'm actually just at home doing some paperwork here on my dining table. Tomorrow we'll be talking about Weird Headache Wednesday. So sometimes people can get some really strange headaches, where we're talking about not just sort of tension headache and migraine, not the really common ones, but also some really different ones. So ones like cyclic vomiting syndrome, vestibular headache or vestibular migraine, and a couple of others as well. So watch out for that. I look forward to talking to you all about that. If there's any questions below, please make sure that you type in the questions around there. Rachel, got a question here from Rachel before we finish. What about if you only get it around yes, okay, so around your hormones. So Rachel, I'm doing a video about that on Friday this weekend, talking about hormonal headache specifically because it's such an interesting topic about all of that. But I can tell you that, it's not all that it seems when it comes to hormonal headache. So when it comes to hormonal headache, there is a hormonal aspect to it, but sometimes it's actually a bit of a scapegoat. So it's not always the hormones that cause it. Yeah, there is a bit of a component to it, I'll admit that, but it's not always the case. So I'll wait until Friday to talk about that one because I reckon they'll be really exciting to talk about it. Rachel, what I'd ask you is, do you get your headache more on one side or do you get it on the other side? Can it swap around or is it on both sides? Because that would give us a really good idea if your neck might be sort of a factor when it comes to that. And yes, tomorrow, just to finish off, so tomorrow on Wednesday we'll be talking about vestibular headaches and some other things. And yes, and tomorrow we'll also cover the Botox as well, given that's a pretty weird treatment for headache and migraine as well, which we went to a conference about a couple of weeks ago in Melbourne. So we'll talk all about that. Awesome. All right. Well, I've got to get back to doing some paperwork here today and preparing for tomorrow's video. If there's any questions down below, type them through. And what we'll do is, if you've got any questions, I'll actually reply to you directly via Messenger because we're looking to get as much information out there to everyone as possible. Tag, like, comment, share underneath anyone who might find this interesting. And I will talk to you again tomorrow on Wednesday. Take care and bye for now.